Here are the latest numbers from the CDC. The U.S. now has more than 17,000 confirmed cases with infections in every state. California with the most, followed by New York and Florida. Cases so far primarily impacting men who have sex with men. Friday, CDC Director Dr. Rochelle Walensky expressed cautious optimism about the agency's efforts to contain monkeypox. 3 months into the U.S. outbreak of the virus, the rate of increase of monkeypox is lower than in previous weeks. Though the virus continues to spread, there is data to suggest the worst may be over.
We have started to see globally that we may be turning a corner. There are certain jurisdictions, New York, Chicago, San Francisco, that are starting to report that they're starting to see a downward trend. I want to be cautiously optimistic.
And joining us now is Dr. Amish Adalja, senior scholar at Johns Hopkins Center for Health Security. Doctor, as always, it's a pleasure to have you on our show. Do you agree with the CDC director there? Could we be turning a corner?
I do agree. When you look at the data coming in from some of the jurisdictions that got hit the hardest and the first, we're starting to see a bending of the curve. We're also seeing that globally. And I think it makes sense because people have changed their behavior. Some people have gotten infected and have immunity, and we have vaccine going into the at-risk community.
Should we be at all concerned about monkeypox heading into these colder months?
Monkeypox is something that doesn't spread like a respiratory virus. It spreads through close contact, skin-to-skin contact. There's not really going to be something with seasonality associated with it the way there are with respiratory viruses. This really is about close contact. What we have to worry about is making sure that we have enough resources to continue to blanket the at-risk population with vaccines, with antivirals, and with testing.
Let's switch gears a little bit with kids going back to school across the country. How worried should parents be with the threat of, well, not just monkeypox, but also particularly with COVID-19?
Monkeypox is not something that's going to be a major disruptive threat to schools. Again, it requires close contact. It's not something that's going to spread very easily in schools. With COVID, I think we have to expect that there are going to be cases, but we have to really reflect on where we are in this pandemic in 2022, that this is not the same issue that we had in 2020. We've got the whole population eligible for vaccination. We have monoclonal antibodies, rapid tests, antivirals. So we've successfully, I think, shifted COVID-19 from something that could threaten hospital capacity to an outpatient illness. So I think that schools have to prioritize in-person learning, and their guidance should reflect the fact that this is not the same threat as it once was because of all the tools science and medicine have given us.
You say it is not the same threat. What type of threat level would you give COVID right now, given that its ability to mutate? We've seen all this Omicron and all of its subvariants. What threat does it pose for us in the coming months?
The threat is around the level of other respiratory viruses. It's not something that has the same ability to kill that it once could. This is something that's going to continue to mutate, but you have to remember that even with those mutations, even with Omicron, if people are vaccinated, if people have immunity, they may get infected with COVID-19, but their risk of severe disease is going to be very low because of that prior immunity. So the threat level has significantly changed. Just looking at what's happening in hospitals, for example, I just rounded out a hospital